Did you know onions are one of the oldest vegetables we've cultivated? They've been around for thousands of years, enjoyed by the Romans, Greeks, and many other cultures, both as a delicious food and a natural remedy. But here's a fun fact. Eating onions can actually be great for people with high creatinine levels and reduced kidney function. Surprising, right? You wouldn't think those tear-inducing bulbs could help your kidneys, but they do. Stick around to find out why you should definitely include onions in your renal diet. And before we dive in, make sure to like this video for more health tips and subscribe to our channel for all the best advice on healthy living. 1. Nutritional content. When it comes to nutrition, raw onions are surprisingly light on calories, packing just about 40 calories per 3.5 ounces, 100 grams. They're also incredibly hydrating, consisting of 89% water. In terms of macronutrients, they're made up of about 9% carbohydrates and contain a modest 1.7% fiber, with small amounts of protein and fat. Now, let's zoom in on how onions fit into a kidney-friendly diet. For those concerned about kidney health, it's essential to note the potassium and phosphorus content of this vegetable. Onions are notably low in potassium, with around 146 milligrams per 100 g, and have a minimal phosphorus content of about 29 milligrams. These characteristics make onions a favorable choice for people managing their nutrient intake, particularly those with kidney issues where potassium and phosphorus levels need to be monitored closely. Now, let's talk about sodium. One of the major considerations for kidney health is sodium. While our bodies need sodium to function properly, consuming too much can be harmful, especially if you have kidney issues. Excess sodium can lead to complications like high blood pressure, discomfort during dialysis treatments, and fluid retention around vital organs like the heart and lungs. Here's where onions can be particularly beneficial. They offer a natural way to improve flavor in meals without relying on salt. You can easily swap out salt for fresh onions in dishes like stir-fries, soups, stews, dips, and salsas. It's a simple yet effective way to enjoy delicious food while taking care of your kidneys. 2. Reduces creatinine levels. If you've been following our videos, you've probably heard us talk about the importance of creatinine levels in kidney health before. Make sure to catch those videos on our channel. But let's break it down again. Creatinine is a waste product that comes from digesting protein and breaking down muscle tissue. Your kidneys play a crucial role in filtering this waste out of your blood. Now, here's where onions step into the spotlight. They're not just for adding flavor to your dishes. They actually offer some pretty cool benefits for your kidneys, especially if you're dealing with high creatinine levels or kidney issues. So, what makes onions kidney-friendly? One word: prostaglandin. This compound found in onions helps your kidneys in several ways. It helps maintain glomerular filtration, which is the process of filtering your blood, regulates how your kidneys handle water and sodium, and even helps lower blood pressure. All these functions combined can help slow down the progression of kidney disease. It's like having a natural kidney support team right in your kitchen. But there's more to onions than just prostaglandin. They also contain quercetin, a powerful natural flavonoid. In a 2018 study, researchers looked into how quercetin could benefit kidneys in a rat model of chronic kidney disease. What they found was impressive. Quercetin not only prevented excessive protein in the urine, a condition called proteinuria, but also improved overall kidney function. It achieved this by reducing levels of fibroblast growth factor 23, FGF23, and parathyroid hormone, which is necessary for maintaining balanced calcium and phosphorus levels in your kidneys. The next time you're cooking up your favorite meals, don't forget to add some onions, not just for taste, but for their potential health benefits too. 3. Prevents kidney stones. You might not think of onions as more than a cooking ingredient, but they have a fascinating role in preventing kidney stones. Onions have low to medium amounts of oxalates, which are natural compounds found in many plant-based foods. When you follow a low oxalate diet, you're cutting down on these compounds to manage conditions like kidney stones. So, what exactly is a kidney stone? It's a solid piece of material that forms in the kidneys and passes through the urinary tract. These stones can be incredibly painful and are often formed from uric acid, a waste product that your body normally expels through urine. To manage this, doctors often recommend a low oxalate diet, limiting your intake to about 40 to 50 milligrams per day to reduce the risk of stone formation. This means being mindful of foods that are high in oxalates. Now, Here's where onions come into the picture. A study from 2024 explored how onion tunic extract could help prevent kidney stones in lab rats. Researchers used an ethyl acetate extract from onion tunics, which are the outer layers or peels of the onion, to create a flavanol-rich extract known as onion peel extract, OP. The study found that OP had significant diuretic properties, meaning it helped increase urine production, which is fantastic for flushing out the kidneys. But that's not all. OP also helped reduce oxidative stress, a primary risk factor for various kidney issues, including nephrotic syndrome, electrolyte imbalance, and decreased kidney function. Oxidative stress happens when there's an imbalance between free radicals and antioxidants in your body, leading to cell and tissue damage. By reducing oxidative stress, the onion peel extract helped protect the kidneys from damage and prevented stone formation. So, next time you're thinking about what to include in your diet, don't overlook onions. 4. Safe protein intake. When your body processes protein, it creates waste that your kidneys need to filter out. If you have chronic kidney disease, CKD, too much protein can make your kidneys work overtime. That's why managing your protein intake is so important. For those with a moderate level of kidney function, which is measured by an estimated glomerular filtration rate, or eGFR, of around 60 milliliters per minute, and who don't have nephrotic syndrome, it's generally suggested to limit protein intake to about 0.8 grams per kilogram of body weight each day. Research shows that going even lower, down to about 0.6 grams per kilogram, can be safe for people with reduced eGFR. This is where onions can be a beneficial addition to your diet. Onions are naturally low in protein compared to other foods, which makes them a safe option for people managing their protein intake, especially if they have kidney concerns. They offer flavor and nutrients without burdening your kidneys with excessive protein waste. 5. Supports general kidney health. Onions, particularly their folate content, can support kidney health, especially for patients affected by CKD or end-stage renal disease, ESRD. Firstly, CKD and ESRD unfortunately come with increased risks, particularly when it comes to cardiovascular issues, which can seriously impact your overall health and lifespan. Now, when we talk about B vitamins, like vitamin B9, folic acid, they're crucial for various cellular functions. They help in synthesizing important compounds like purines and pyrimidines, which are essential for DNA and RNA formation. Additionally, these vitamins are involved in maintaining healthy red blood cells through erythropoiesis. Now, erythropoiesis might sound like a big word, but it's simply how your body makes red blood cells. These cells are super important because they carry oxygen from your lungs to the rest of your body, keeping everything running smoothly. Here's where it gets interesting for those with CKD and ESRD. These patients often have higher levels of homocysteine in their blood compared to the general population. This condition, known as hyperhomocysteinemia, isn't just due to reduced kidney function, but also abnormalities in how the kidneys metabolize homocysteine. Now, while homocysteine is a small molecule that can pass through the kidney's filtration barrier, most of it circulates in the bloodstream and is bound to proteins. This abnormal metabolism contributes to elevated homocysteine levels, which can increase cardiovascular risk. Given these factors, supplementing with folic acid, possibly along with vitamin B12, makes sense as part of the treatment plan for CKD patients. Folic acid helps lower homocysteine levels, which can reduce the cardiovascular risks associated with kidney disease. Including folic acid-rich foods like onions in your diet can naturally support this approach. It's a small dietary adjustment that can have meaningful benefits for overall well-being. Now, before you start crunching on raw onions like apples, let's talk about a few things. Eating too many raw onions can cause some stomach troubles for some people like bloating, gas, and heartburn. So, it's a good idea to enjoy them in moderation to keep your digestive system happy. And a quick tip on storing your onions. Keep them in a cool, dry place. This helps maintain their nutritional quality. If they get too warm or moist, they can spoil faster and lose some of their health benefits. Despite these small precautions, don't shy away from adding onions to your meals. They bring awesome renal benefits and a punch of flavor. Thanks for hanging out with us. If you enjoyed this video, give it a like and hit that subscribe button for more health tips and advice on living your best life. See you next time.